If you're prepping for your MMI, a few questions can really trip you up, even if you're a top candidate. In this video, we're breaking down 3 scenarios that can really make or break your interview. Navigating your duty as a doctor, choosing between personal and professional life and how to balance that, and incorporating ethical principles like patient autonomy. We'll show you how to stay grounded, ethical, and strategic, even when the stakes are the highest. So welcome back, Dr. Weisholtz. Nice to see you again.
You too. Happy to be here.
Nice. Today we're going to be talking about MMIs, as you know. And first I want to just talk about with you, what is the purpose of an MMI and what are AdComs and admissions committees really looking for in an MMI interview?
Oh, those are great questions. And by the way, MMIs are relatively new. They're a type of situational judgment, a test, one of the couple of ones out there. And MMIs are a type of interview that allows schools to assess how you as an applicant can think and communicate, and most importantly, respond under pressure. And these are skills you'll be using daily once you become a physician. Now, the important thing to remember is that admissions committees aren't looking for perfect answers, and there isn't a single perfect answer for MMI scenarios.
Right.
But we want to help see how you work through the tough situations aloud.
I totally get that. And I actually have a lot of students who are so worried and so anxious and nervous going into MMI interviews. And the way that I phrase it is, it's actually an exciting opportunity to show a totally different side of you and to really show them why you want to be a medical student, what kind of medical student you would be. And so in a way, if you reframe it in your mind as like an exciting opportunity, that kind of allows you to go in with a little bit less of that, nervous energy into the MMI experience.
Absolutely. It's a way for you to verbally show how you think. I want to see your thought process when given different cases. And once you become a medical student and a future doctor, you'll need to be doing this on medical teams during rounding.
Absolutely. It's all about reasoning, just in the same way as doctors, you're expected to do clinical reasoning on the wards all the time, right? With that being said, what kind of scenarios can students expect in an MMI? I know that there are some ethical dilemmas, but what else might they see?
Oh, yes. It's a whole spectrum. And that's kind of what makes it fun and exciting, like you just mentioned, right? You don't know what to expect, but just like life and in medicine, there are lots of different cases. So a couple of different scenarios. Now, keep in mind that these are designed to test how you think, communicate, and then basically how you handle tough decision making. Ethical dilemmas are definitely top of the list. These are cases like choosing which patient gets a life-saving treatment. And then we're going to have scenarios like interpersonal conflicts. The classic one is addressing a team member on a team project who might not be pulling their weight. You probably have experiences already in high school or college. And then it goes beyond, and there are situations like having you think through cultural sensitivity, like treating a patient whose beliefs might conflict with medical advice or with your own. There are also some policy questions, like discussing your opinion on vaccine mandates. And there are, instead of the interview format, there are active role plays. And that's where we want to see how you handle breaking bad news to a patient or a caregiver.
Absolutely. I've even seen some schools transition to start using more open-ended questions, even just tell us about a time when XYZ, and that's just the entire MMI interview station.
Exactly.
So, no matter what the question is, these prompts involve hard choices between personal values, sometimes professional obligations. There's, again, no clear right answer, but sometimes there is an approach that you can take for the MMI format once you're in the room. And for me, one of my tips that I use when I recommend structuring a response is to kind of think almost as if you're writing a paragraph. So an intro, a body of the paragraph, and a conclusion, and to try your best to speak in full sentences, almost as if you're writing, and the thought with a period, and then move on so as not to ramble on and on, which is one of the biggest concerns of students.
And to add to that, something that I love are mnemonics, as you probably have known. So I have one I would love to share with you today.
Yes, let's hear it.
It is mnemonic. It's WOW, W-O-W, just like the paragraph structure that you had, 3 parts. And I have students remember this as a way that they can wow the interviewer during their MMI interview. And that mnemonic stands for what, options, and why. So start with the what. Define what the dilemma or the situation is in the scenario you're presented. Clearly state the main issue that they're trying to convey or that you identify. The O is for options. And this is kind of like the fun part where you lay out the reasonable options or choices, considering pros and cons and different decisions you can make in this process. And then you have to choose one or two of them. And that's the last W of wow, which is why. You have to explain why you chose your final course of action, tying in your understanding of ethics, empathy, and logic. And this is where you really have to be able to be confident and defend your thought process.
I love that. Wow. I'm definitely going to remember that. And I really like how you leaned into the idea of showcasing different perspectives, but at the end of the day, still choosing a side. And I think that's important to remember that you do have to come to some sort of conclusion and defend that conclusion, even if you go back and forth between different.
Yeah, and again, it's the whole process. We want to see what you're thinking, like to know that there are different options out there, but then you're able to commit to a decision component at the end, which you ultimately have to do as a doctor.
That framework in mind, should we look at some examples?
Absolutely.
All right, well, let's take a look. So in this first scenario that we're going to look at, you are a physician in a pediatrics department. You have this family holiday vacation coming up. You've already planned it. And now you're informed that somebody needs to be on call. And even though you kind of took all the appropriate channels, somebody needs to be on call, and it might have to be you, and you need to figure out what to do in this scenario. So this is a common kind of example of choosing between personal and professional responsibilities, which physicians commonly have to do. What do you think about this example, Dr. Weisholtz?
Yeah, so this absolutely is realistic. And I bet every medical student or resident and fellow and attending out there has experiences in some degree. So this scenario is something you might encounter, and it tests a conflict between personal and professional commitments, that work-life balance.
This situation, again, like you said, requires balancing your commitment to work and your genuine need for rest and for family time, especially acknowledging how real physician burnout is, right? And how you can't just jump in and cover every time something needs coverage. So I think a mature answer would acknowledge the need for self-care and the responsibility to patients as well. What steps would a student consider in that WOW acronym that you described, maybe for the options here?
The first is to identify the issue, and that's the W for what and wow. And that's just to acknowledge that this scenario presented has a conflict between personal and professional commitments or work-life balance. You made plans for a much-needed family vacation, but due to a scheduling error that was not yours, you might be on call, which, really sucks. It puts you in a tough position. You're having to balance your commitment to patient care with self-care and family responsibilities. So that's the first step, is to acknowledge and identify the issue. The second is, well, what are your options at this stage, right? So this is kind of getting towards problem solving. You have to decide, well, what can you do at this point? So a few reasonable options here, and we can just put all the cards on the table, which is you can investigate the error and then ask a colleague if he or she is available to swap or cover your potential call. Another option is if coverage is available, then you feel okay with it, then you could proceed with a vacation. That's like the best case scenario. And then the third option is if nobody can cover, then you may actually have to acknowledge staying and fulfilling that medical duty while maybe the rest of your family has to go on vacation without you or cancel the vacation, etc. So you want to be able to verbally convey all those options as you're answering in the MMI interview to have the interviewer see you work through and consider different options. So that kind of leads to eventually making a decision. That's kind of your call, right? There's no right answer to this, but you have to be able to defend it. So ultimately, the way to think about this for the last component, or W for why, is patient care and departmental leadership are serious responsibilities. And you have to ensure that there's safe coverage of patients. But acknowledge that physician burnout, like you said, Dr. Manolas, it's absolutely real. And you want to be able to begin modeling boundaries. And that shows a level of maturity in your answer. And that's a key component.
Absolutely. And I think the students that stand out on MMIs for me do two things. The first is they actually start to acknowledge more systemic level issues and
Hmm.
solutions. So a lot of the options that you listed are very realistic logistical next steps, which I think listing those would be a phenomenal answer. And I think going above and beyond would be even to talk about how the chair in this scenario might work to prevent similar scheduling issues in the future for all staff, not just themselves.
Yeah, that's right. So planning for the future is one step beyond in a higher level of thinking because you want to think preventative.
Absolutely. And to be proactive instead of reactive, right?
Exactly.
And I think the second thing that really makes students stand out on MMIs is when they're able to tie in a personal experience
Hmm.
that without being too personal, obviously, but this is a pretty realistic situation. And perhaps someone might have experienced something similar to this, even though they're not yet a pediatric department chair. And I think tying in that example and showcasing the interviewer a little bit more about themselves and how they handle those situations is another way to really kind of go above and beyond in these responses.
So I think that when it comes to sharing personal examples, it's great because it again showcases your exposure to a clinical experience that might not otherwise have been on your primary or secondary application. And two, it shows that this scenario is realistic and you've acknowledged that and you're able to think about it and have already gone through it in the real world context. Finally, just again, be careful about sharing personal details. You want to respect any sort of patient interaction or the patient's identity with whom you've worked with. So just be careful of that.
That's a really great point, and it's probably something that we don't always remember to do and really critical. In this second scenario, there is an 89-year-old woman who is diagnosed with a likely metastatic adrenal carcinoma or cancer, and the daughter is asking the medical team not to disclose the diagnosis to the patient. And so I'd love to kind of think about your approach to this, Dr. Weisholtz, and kind of the ethical dilemmas and core principles that this scenario really demonstrates.
Yeah. So this scenario involves a conflict between what we call a patient's right to know and a family member's request for non disclosure. So those are two important terms for listeners to remember. So right to know, also patient autonomy and non disclosure. So this elderly patient has metastatic cancer. Her daughter has asked the team not to tell her. This absolutely raises ethical concerns about autonomy, around also about communication, and maybe a little bit about cultural sensitivity. Different cultures have perhaps younger children taking care of their parents and therefore making medical decisions on their behalf, and particularly if there is a language barrier. So all of this is very realistic in different shapes and forms for cases out there. And to add to that, a lot of medical students with whom we worked with are family caregivers. So they might be in this situation, and this scenario is going to ask you to kind of step out of that role to think about it in a non-biased way.
Mm-hmm. And I think going back to, acknowledging actually what the scenario is asking, which I think you just did. And then the next step really is kind of clarifying maybe why the patient's daughter feels this way. So even going back and asking questions. And I think that's an important strategy in any MMI scenario. It's never wrong to kind of throw it back to the patient's family or the patient themselves and to gather more information, right? So the student in this MMI scenario might ask, can you share with me why you feel it would be harmful for your mother to know? And that will help to explore if maybe this desire to non-disclose or to not to disclose the diagnosis to her mother is based on fear, if it's based on cultural beliefs, or even if the patient had previously expressed to the daughter that she wouldn't want to know these things. And that can help the oncologist in this situation kind of approach it from a more objective perspective, as well as actually, I think, speaking to the patient themselves on their own, knowing how their decision-making capacity is. Are they able to kind of make these decisions for themselves? And do they have the right to know? And those are other kind of things to think about and bring up in a scenario like this.
And that actually brings up a great point I wanted to make about MMIs is because it's in a timed response kind of interview format, the students are often feel pressure to answer right away and to get to the decision making process. And they forget two key points, which is one, you can always step back, explain how you would ask for more information. And two, which is not brought up in this case so far, but you can try to consult with colleagues and ask for outside help as well. That's why we have a lot of medical specialties. We have experts in certain areas. We have social workers and therapists. Don't forget this entire support network in medicine to help physicians.
Absolutely. And I think it's actually a mature way to answer an MMI question is to take a pause. First of all, take a few seconds, think about it, then answer, ask more questions. And that actually shows a level of emotional maturity that, again, doesn't always get demonstrated on a primary application or on grades or GPA.
That's right. Yeah. So, Melina, let's talk about the options in this case. So, a couple of the ones that we can think of and just brainstorm right now, as if we were doing the real interview, would be, well, the first option is you already brought it up, which is to speak privately with the daughter to understand her concerns, like whether they're cultural, emotional, are they based on past conversations, etc. And the second is to speak privately with the patient. And that allows you to assess the patient's mental capacity and also ask her how much she wants to know about her health. And then if the patient is capable and wants information, perhaps you might want to gently disclose the results with support. And of course, you want to reassure the daughter that her concerns are respected and that the approach centers on her mother's values and dignity. So if you take all of that together, it kind of leads to the final why. So this case is a little bit more where there's no right, perfect answer, but it does push you towards a certain decision-making conclusion, which is ethically, if the patient is capable, she has the right to make informed decisions about her own care. Again, emphasizing patient autonomy. However, because there's a family member involved in this case, we still want to be respectful and honor the daughter's intentions. And so we would approach the conversation probably with a lot of empathy and care, ask a lot of questions, gather a lot of information. So this way we can balance honesty for the patient with their right to know, with the compassion and uphold both autonomy and any sort of cultural sensitivity in support of family members.
I'm so glad you brought up that last point because I think a mistake that I commonly see when answering these ethical dilemma type of questions is that students are really eager to show off their, studying of these ethical principles, which is excellent. And I think that is one thing that you probably should prepare ahead of time is just kind of getting familiar with these terms, but not to forget that the intention of the daughter here is really genuine and to really respect that and acknowledge that without focusing too much just on the patient autonomy itself is something that might get overlooked. So thank you for bringing that up. Now, in this third scenario, you are a second-year medical student in the OR, in the operating room, and after the patient is under anesthesia, the doctor that you're working with makes inappropriate, sort of mocking comments about the patient's weight. And this is a really, really, unfortunately, realistic situation that truly might happen as a medical student. And I think it's so important to address this because it brings up these really core ethical issues of professionalism, patient dignity, and more.
Yes, absolutely. This scenario raises exactly what you said, Melina, professionalism. And in addition to professionalism, respect for patients. Patients are always going to be the ones who come first. Now, remember, when you're a physician, even when you're a physician in training as a medical student, you're on stage. That's the way I like to think about it. So you have to uphold to the utmost of professionalism for being a physician. Whether or not you're a second-year student, this scenario can be true once you are a resident, once you are another doctor of the same caliber in the OR with this doctor who's making the comment. So it could be true at almost any point in your career.
Let's talk a little bit about the what. So I think we just kind of hit on that actually. And then kind of go into the options in your WOW acronym. How should a medical student actually approach this?
So just to summarize for the what, this scenario raises some serious concerns about professionalism for the doctor who's making the comments. The scenario is trying to get you to think about respect for patients. And as a second-year student for this scenario in this case, you've witnessed a doctor making mocking comments. That's really clearly a breach of trust and violates the dignity that patients deserve, especially when they're in their most vulnerable. She's under anesthesia.
Yeah.
So what are the options? Looking at the whole spectrum, the first thing you could do is you could just stay quiet to avoid conflict because you To be honest, you're going to feel uneasy about this. You're a second year medical student. There's a medical hierarchy in the OR, right? It's a surgeon who might be making this comment. This might be your first day on your surgery rotation.
This attending might be evaluating you, right?
Exactly. So you're going to feel uneasy about it. To avoid conflict, you might just want to stay quiet. But you also might want to act upon it because it makes you feel so uncomfortable. You don't want to return to this type of environment, right, as a learner. So you can request a private, respectful conversation with the doctor to express your concern. If that doesn't feel like the right thing to do for you, or if you're not comfortable, you can also seek guidance from a mentor. You can talk to your clerkship director, report it through appropriate channels. You can talk with an OR nurse about how to handle it. Is this common behavior? So again, this option hits on the bigger theme where you can reach out to ask for guidance from others. It doesn't have to be either or, like you report the doctor or stay quiet.
Right. Medicine is a team sport, right? So exactly like you said, the medical student does not need to handle this alone. In fact, a better answer might actually state that you do ask for help.
Exactly.
To recognize that hierarchy, that power hierarchy. And also a really important point that you brought up is to kind of address this in private with the physician, right? Because in the same way where we're talking about professionalism, probably calling out the doctor in the middle of the procedure or, saying it in front of some of his or her colleagues might not be the most professional way to go about this.
That's exactly right. So in this scenario, is testing your ability to respond in a specific setting when it's appropriate, and also timing, like what is the best timing to troubleshoot or make decisions. And so here, you don't want to disrupt the surgery. You probably don't want to call out the surgeon or the doctor while they're operating, but it's equally important for you to uphold respect of the patient later and reflect on this case. So in your answer for this MMI scenario, you want to talk about reflecting and then acting upon it.
Absolutely. And I think this is one of those cases where perhaps it is a little bit murky water to share a personal example, right?
Yeah.
It could go either way. You would have to do it really, really professionally.
Here's a trick for that. So if it's a little bit murky and you don't want to say you had an experience and there was such and such surgeon whom you witnessed, that's okay. You don't have to use that example. Instead, you can respond by talking about the kind of medical culture you want to be a part of, that you would want to create, right? You can say that if I were a future surgeon, I would be very aware of what I say if I'm in the operating room, and I would proceed as if the patient is always listening. And that is a way that you can uphold ongoing compassion, integrity, and professionalism once you are a physician.
Absolutely. Or bringing up an example of somebody that actually is emblematic of the positive qualities of how you would handle that, right? In your experience.
Yeah.
All right. So we just looked at 3 examples, which I think were really representative of what a student might see in MMI. I'm curious, any top level final tips for people preparing for these MMIs, Dr. Weisholtz?
I do have one, and you might have heard it before, but I'll say it again. The number one tip I give to all of my students is to practice out loud. MMIs aren't just about what you think, they're about how you communicate in real time, and in this case, under pressure. So you can study ahead of time a lot and write down answers, but that won't nearly be as helpful as actually saying your responses and your thoughts out loud, kind of like what you'll do on a regular interview day. So try working with a friend or recording yourself. And the cliche is talking to yourself in your mirror or in front of your stuffed animals. The more you practice speaking out loud in your MMI responses, the more natural and confident you'll sound.
Absolutely. And I think my final level tip is that, very similar to yours, don't over prepare. I think it's important to prepare, but not to over prepare in terms of thinking of every possible scenario that can come up and reading hundreds of different ethical scenarios and different principles and how they apply to each state. I think that's not what we're looking for. Any admissions committee is looking for. And I think it could actually backfire if you show up to this and it says something that you haven't practiced. So instead, going with a framework rather than memorizing answers and kind of over preparing so you're less rigid under that pressure, I think is my big tip for students.
That's right. And when you're not under that sort of memorization pressure to regurgitate like lines and things you've learned, it's also more fun. You're
Right.
talking through a scenario. It's a lot more fun, so you should enjoy it.
As you can see, these tough MMI questions aren't about having the perfect answer. It's about balancing clinical and ethical reasoning with your own personal experiences and being able to actually deliver that in a cohesive narrative. Hopefully this video helped you understand how to show empathy, maturity, and sound judgment under pressure. If you found these strategies helpful, please hit the like button and subscribe for more pre-med tips. And if you want to elevate your MMI skills even more, think about working one-on-one with a physician advisor like myself or Dr. Weisholtz here at Med School Coach. One-on-one coaching with an expert really is the best way to make sure that you avoid the common pitfalls and do your best on interview day. See you in the next video.